Hi, my name is Erica Young. I am a EKU psychiatric mental health nurse practitioner student, and today I'm going to discuss with you a nursing practice issue that I think is important for all providers to be aware of, and that is the difference between rural and urban health disparities. Health disparities are increasingly becoming a major public and national concern as local and national awareness is made available. I believe, like in times past, people may have thought that health disparities only affected like underdeveloped countries, but there's a growing body of evidence that also shows how developed countries also have issues with health disparities among their populations. This growing issue is important to advance nursing practice because of the impact the health inequities and social determinants of health impose on vulnerable populations. The advanced practice nurse's role, though, is very essential to identifying resolutions to this problem. The issues that we have as a result is that these vulnerable populations often have poor health outcomes, often have early death, comorbidities, just a poor quality of life because of these issues. Some may wonder what health disparities are, but according to the World Health Organization, health disparities are the differences in the quality of health many impoverished populations experience. This is due to health inequities such as environmental, biological, cultural, behavioral, and social factors. I have included a non exhaustive list of examples here, which include age, gender identity, disability, geographic location, race, access to and availability of healthcare services, and educational and financial status, etc. These are social determinants of health. And this means that these factors have the potential to negatively impact the health outcomes of vulnerable populations at a greater rate compared to their counterparts or those who live in urbanized areas. The World Health Organization states that environmental, biological, cultural, behavioral, and social factors are health inequities. And these make a difference in the health, um, make a difference in healthcare, healthcare resources, delivery of healthcare, and access among populations, all of which play a pivotal role in the burden of health and disease. I'm sorry, in the burden of disease and physical and mental well being in rural communities. The Healthy People 2020 objective is to achieve health equity, eliminate disparities, and improve the health of all groups. On slide 4, rural versus urban health disparities. There are some differences here. For rural communities, some of these, such as poverty, low educational attainment, race, environmental factors, lack of healthcare providers, and healthcare affordability can impede their access to care, which increases their which increases their risk factors for poor health outcomes as compared, like I said earlier, to urban communities. On the other side, you see urban communities. They have a greater access to healthcare and health resources. They have increased educational opportunities, higher rates of financial stability, and health literacy. However, this doesn't always determine that those living in urbanized areas are healthier. Unfortunately, those, according to the World Health Organization, close to 40% of urban growing populations is in deplorable areas where water and sanitation safety is compromised. Highly processed foods are in greater consumption, and most of their populations are exposed to air pollution. These factors contribute to chronic health conditions, metabolic syndrome, respiratory and mental health illnesses. So, whether one lives in rural or urbanized communities, all of the above listed health disparities have the potential to ultimately compromise the health and well being of citizens all over. How does this impact advanced nursing practice roles? Well, when you have communities that are disadvantaged, oftentimes they have a lack of faith in the healthcare delivery system and a provider distrust. These vulnerable populations may avoid health seeking behaviors, and this results in a decline in their health and overall poor prognosis. APRNs can play a role in bringing resolutions to these issues by being lifelong learners, engaging in leadership and policy involvement, and being knowledgeable of their patient population and what factors impact their health. As I conclude, health disparities include social determinants of health that contribute to disproportionate rates in the occurrence of disease, morbidity, and poor access to healthcare services between rural and urban populations. These differences lead to poorer health outcomes in rural populations as opposed to those living in urbanized communities. Health disparities can negatively impact advanced practice nursing roles. However, APRNs can become a solution to this issue by being well versed and knowledgeable, like I said earlier, of their patient population and the social, environmental, various factors that can impact their health outcomes. Two questions to consider for further discussion. What role does racism play in the healthcare delivery system? And is there a race that is more at risk? Thank you for your time.